My name is Calvin Tebbe. I'm one of the family medicine physicians here, and I'd like to take a moment to discuss the benefits of telemedicine versus inpatient appointments and the utilities for these. One of the big things that telemedicine offers us is that this is an opportunity for our patients who may not be comfortable otherwise coming into the clinic to go over some of the symptoms that they may be experiencing and kind of have a face-to-face with us. Now, one of the downsides of telemedicine is we obviously don't have the advantage of a physical exam, so we can't, feel for any sort of like masses on the abdomen or anything along those lines. So there are some limitations. Now, it can be difficult sometimes to figure out, what appointments are appropriate for telemedicine, what appointments are appropriate to come in person for. So I want to hopefully clarify some of that for some people. One of the big opportunities I think that we have for telemedicine is for a lot of like the bread and butter upper respiratory infection kind of stuff. This is something that a lot of times is managed very conservatively unless there are certain red flag symptoms, which we do like to look out for. So for example, if you're having issues with like a persistent fever that's lasting 10 to 14 days, and typically as a fever we define as greater than 100 degrees Fahrenheit, or if you're having symptoms that may have started to get better, classic upper respiratory kind of symptoms like nasal congestion, sinus pressure. If they start to get better, but then they suddenly take a turn for the worse, that's another sign that you may need to be seen in person. However, if it's a classic common cold type of symptom, we usually manage that conservatively, and it may not necessarily be something that you need to actually come into the office to be seen for. Another thing that is pretty common, I would say, is urinary tract infections, and UTIs. Oftentimes these will present with some combination of having to go to the bathroom a lot. Sometimes you'll see blood in the urine, and sometimes you have a pain with urination as well. So if you have these constellation of symptoms, now this is also provider dependent. Some providers like to have a culture to determine antibiotic susceptibilities for any sort of possible bacterial infection. But a lot of times, if there is no history of atypical urinary tract infections, if you don't have any history of bacterial resistance, a lot of times these can also be managed through a telemedicine appointment. I would like to add the caveat that, obviously with UTIs and with other processes as well, it would be worth discussing with your physician about your situation specifically, and what processes might be more beneficial to do telemedicine for your case specifically versus what you should come into the office for, because obviously everybody has their own medical history and everybody's situation is unique, so it's certainly not a one-size-fits-all kind of thing. But another opportunity for using telemedicine, which I think is a very great opportunity, is for mental health. A lot of times for people who are suffering from anxiety or depression, for example, the physical examination findings aren't necessarily as important as what's going on the inside. How are you responding to certain medications that we're prescribing? How is the therapy working? And a lot of times these can be managed through a remote visit, a telemedicine visit. So this is another good opportunity for you. Obviously, there can be a lot of exceptions to the rules, and everyone's situation is unique, so I really don't want to present you with a one-size-fits-all kind of situation. So if there is any question to whether something can be managed remotely versus in person, I'd strongly recommend talking to your doctor about your options and coming to a decision as a team about what may be the best option for you.